COVID-19 pandemic has crossed the one-year mark. Cases, hospitalizations, and deaths continue to trend downward. But even with that progress, we cannot let our guard down. Using data to inform the response to the COVID-19 pandemic can help improve COVID-19 testing and vaccinations, in turn reducing illnesses, hospitalizations, and deaths. COVID Data Tracker is CDC's easy-to-use home for COVID-19 data. It offers easy-to-interpret visualizations, such as interactive maps and graphs of vaccinations, cases, hospitalizations, and more. Grouping data by category makes it easier to find the data you need. CDC is helping people across the country get vaccinated while tracking the progress of the National Vaccination Program and sharing that data publicly. There has been significant progress in vaccination. While COVID-19 vaccinations are increasing across the country, Black, Hispanic, Latino, Asian, and tribal communities are currently getting COVID-19 vaccines at lower rates than white communities. By using data to drive vaccine implementation and the response to the COVID-19 pandemic, cases, hospitalizations, and deaths could continue to trend downward.
Good morning, everyone. Thank you for joining us again for the second plenary session of the National Forum on COVID-19 Vaccine. I'm Dr. Jay Butler, Deputy Director for Infectious Diseases here at the CDC in Atlanta. I'm so honored to be a part of this forum and to welcome you to our first session focused on how we can effectively use data to drive our vaccine implementation. For most of us gathered virtually today, this isn't about a program. It's not a job or a project. It is a cause. It is our passion. A vaccine given is not just a dose administered, it's potentially a life saved. A sobering reminder as we pass the mark where more than 500,000 of our fellow Americans have lost their lives to COVID-19. We're acutely aware that during this historic time, we have the mission, the responsibility, and the capacity to deliver as many vaccines as we can to as many people as we can, and to do it safely and fairly. All across the country, this is happening. From Alaska, my home state, where vaccine is being transported throughout the state by boats, ferries, planes, and snowmobiles, to San Francisco, or rather San Diego, where vaccination super sites, like the one at Petco Park, are vaccinating thousands of people every day. And we're seeing grit and innovation to make vaccine available to as many people as possible. In New Orleans, we've seen a communication campaign grounded in local flavor and culture that speaks to the people in the community. In Colorado, there's a government-private partnership, the Champions for Vaccine Equity Task Force, where the Department of Health and 10 medical champions of color are working with and through community-based organizations to create opportunities for listening and sharing information about COVID-19 and COVID-19 vaccines. There are thousands of success stories happening across the country every day. During these 3 days, we're able to shed light on some of them for you. Over 12,000 people from every state, Washington, D.C., 7 territories and freely associated states, and 189 tribal nations and organizations have joined us, representing nearly 6,000 different professional organizations. As COVID-19 vaccines roll out in communities around the country, it's important to ensure equitable access to everyone, especially people who are at increased risk for COVID-19 or face systemic health and social inequities. To improve vaccination, data guides our way, helping us to develop our plans and change our plans if an approach is not working, and enabling us to hold ourselves accountable for getting vaccines in people's arms quickly, safely, and equitably in every community. Our speakers today will share their stories on how they've been contributing to this historic vaccination effort. They will highlight their challenges and lessons learned. This work has not been easy. We're confident that their stories can provide all of you with practical ideas on what you can do in your organization to bring COVID-19 vaccination to all community members. Our first speaker, I'm very pleased to introduce, is Dr. Bashara Shokar. I had the pleasure of meeting Dr. Shokar just before the pandemic hit, and I've enjoyed continuing to work with him. He's responsible for overseeing the national vaccination efforts as the vaccination coordinator for the White House COVID-19 response team. So at this time, I will turn it over to Dr. Shokar.
Thank you so much, Jay, and it's good to be with you all today. Thank you for this opportunity. And before I start, I wanted to touch on this truly grim milestone of more than 500,000 fellow Americans who lost their lives due to this pandemic. It goes without saying, this is unbelievably heartbreaking, and nothing we can say or do can make it better. The president said it yesterday, the way through sorrow and grief is to find purpose. For me, for our team, and I know for all of you, that purpose is to end this pandemic quickly and equitably, and we all have a role to play. I'd like to start by giving an overview of the Biden administration's national strategy for the COVID-19 response. And I think we all agree that America deserves a response to the pandemic that is driven by science, driven by data, and driven by public health. And at the start of the administration, the president announced a comprehensive whole of government national strategy to fight the pandemic that not only improve the effectiveness of our fight against COVID-19, but also helps restore trust, accountability, and a sense of common purpose in our response. There are multiple tenets to this strategy that start with restoring trust, mitigating spread, looking at immediately expanding emergency relief, safely reopening schools and businesses and travel while protecting workers, protecting those at most risk and advancing equity, and restoring US leadership globally and building better preparedness for future threats. And of course, the strategy included a particular focus on mounting a safe and effective and comprehensive vaccination campaign. And that's where I'll spend the next few minutes discussing. So on the vaccination front, our work can be broken into three primary buckets of effort. One, increasing the vaccine supply. Two, increasing the number of vaccinators. And three, providing more places where people can get vaccinated, including supporting state and local partners. So let me start with the supply. Supply of vaccine continues to be front and center to so many of us across the country. 5 weeks ago, states, tribes, and territories were receiving a weekly allocation of about 8.6 million doses. Last week, we announced that we will increase weekly allocation to state, tribes, and territories to 13.5 million doses. So that's a total of about 57% increase in vaccine supply across the first month. And in line with that effort, we promised to increase the visibility of incoming supply to states and jurisdictions. Now, we are and we will continue to provide a minimum of 3 weeks supply visibility so that states and local partners and territories and tribes can prepare better for vaccination plans. We have also secured the equipment required to extract that sixth dose from every Pfizer vial of vaccine. And now all vaccine kits that are shipped to states, tribes, and territories with Pfizer vials contain the syringes required to extract that sixth dose. So a lot of progress on vaccine supply, and we continue to focus on that part of the strategy. I also want to spend a few minutes talking about our efforts on making sure there are more places for people to get vaccinated. And we continue to work with states, tribes, and territories to create new convenient locations for vaccinations. There are new community vaccination centers that are popping up across the country, mobile vaccine units, new programs with pharmacies, and a program with community health centers. So on the community vaccination centers, FEMA is providing supports to states, tribes, and territories to stand up these high throughput centers across the country. This includes financial support, staffing support, and some technical assistance to stand up and operate these sites. FEMA is also supporting states for costs related to vaccination operations at 100% reimbursements. Over the last 5 weeks, FEMA has obligated $3.8 billion to over 44 states, tribes, and territories to support these community vaccination centers across the country. We've also deployed substantial federal personnel nationwide in response to requests from states. We've assigned over 1,300 FEMA staff to support vaccination sites across the country, and we've deployed over 800 vaccinators across the country. And for the first time, we've deployed active duty military to support these operations, and will continue to deploy more as needed. On the pharmacy front, 2 weeks ago, the federal program began delivering vaccines directly to select pharmacies across the country on top of jurisdiction allocations. This provides more sites for people to get vaccinated conveniently in their communities. And this is a critical step to provide the public with convenient, trusted places to get vaccinated in their communities. This program is a public-private partnership with 21 national pharmacy partners and networks of independent pharmacies representing over 40,000 pharmacy locations nationwide. And we're proud to say that this program is off to a good start. The program received its first 1 million doses last week, and based on performance, we've increased allocation from 1 to 2 million doses this week. And then I want to spend a minute on community health centers. 2 weeks ago, we announced that we're launching a vaccination program with federally qualified health centers. This is part of a broader equity efforts focused on the underserved and hardest hit populations. There are more than 1,300 community health centers serving over 30 million people, serving about 30 million people across the country, 2/3 of whom are living at or below the federal poverty line, and 60% of whom are racial and/or ethnic minorities. This week, we are in the process of shipping doses directly to federally qualified health centers on top of jurisdictional allocations. And this program will take a phased approach and will ramp up as more vaccine supply becomes available. A set of community health centers started ordering vaccines last week, and we're allocating 1 million doses to approximately 250 centers across this initial phase. So thank you so much for your time today and for this opportunity to speak with you. Data is showing that we are making progress. As of this morning, over 64 million doses have been administered in this country, but we are not satisfied. We will do everything we can to continue expediting the pace of vaccinations. We all have a role to play. Thank you so much for everything that you are doing for getting America vaccinated and getting us past this pandemic. Thank you so much.
Thank you, Dr. Shokar. That's a fabulous overview of the whole of government response, and it really sets the stage for the discussions that will follow about the all of us approach that we need to take to deliver vaccine to all Americans that would like to be vaccinated. So now it's my distinct honor to introduce my boss, CDC's new director, Dr. Rochelle Walensky. In Dr. Walensky's brief tenure at CDC, she's made it clear that science, transparency, and equity are central to CDC's work. Today, Dr. Walensky will provide a COVID-19 response update and an overview of CDC's data resources that guide decision-making. Dr. Walensky.
Thank you so much, Dr. Butler. I want to thank all of the practitioners here today. You are on the front lines of implementation for the COVID-19 vaccine. Your commitment to combating this pandemic is inspiring. Prior to coming to CDC, I served on the front lines of the COVID-19 response and saw the challenges patients and communities encounter in the face of this pandemic, how they work to stop the spread and to reduce morbidity and mortality. Now in my new position, as we partner together to scale up implementation of COVID-19 vaccines, I want to assure you that CDC will lead with science, transparency, and equity. Science is and always will be the cornerstone of our work. The COVID-19 pandemic has underscored just how much we need credible data that moves faster than disease, is openly and objectively reviewed, and communicated in a transparent and honest manner. COVID-19 cases have been declining for 5 weeks. During the 7-day average of the past week, cases decreased nearly 29%. New hospital admissions have also been in decline since early January, with a 20% decrease in the 7-day average over the past week, averaging 6,625 admissions per day. The daily number of reported deaths continues to decline. The latest data indicate deaths have declined 38% to an average of 1,921 deaths per day. We are also closely tracking progress on vaccine administration. CDC's COVID data tracker gives us a near real-time picture of vaccination distribution and administration data. More than 75 million vaccine doses have been delivered, and approximately 64 million doses have been administered. This represents more than 44 million people who have received at least one dose of the COVID-19 vaccine, and approximately 20 million people who are fully vaccinated receiving 2 doses. As I mentioned yesterday, unfortunately, I suspect you also know that we are seeing significant drops in routine childhood vaccinations and routine immunizations in older adults during the COVID-19 pandemic. We have highlighted these challenges in publications recently in CDC's MMWR. We worry about the downstream impact of these losses. These challenges highlight the need to track other vaccine-related impacts of the pandemic and work to support vaccinations more broadly as we also work to scale up COVID-19 vaccinations. Data are critical to drive decision-making and underpin our ability to understand and respond to this pandemic. CDC is collecting and reviewing data on vaccine administration and adverse events. We are then sharing clear and accurate information to help the public understand the risks and benefits of getting vaccinated so they can make informed decisions. Data are also being used to engage communities equitably and inclusively to ensure people can ask questions and get clear, accurate information about COVID-19 vaccines. CDC and our response partners are sharing data to help states plan for how to distribute vaccines to reach all Americans. One particular area of interest is related to equitable vaccine distribution and tracking vaccinations by race and ethnicity. As you can see on this slide, we are able to present by jurisdiction how complete this race ethnicity data are and how this has changed over time. This reflects just one of many important data inputs to track our progress on vaccine equity. Providing CDC's COVID-19 vaccines nationwide requires an unprecedented logistics and coordination among public health authorities and private sector and community partners. Integrated IT systems, public, private, new, and existing, are needed to ensure successful vaccine allocation, distribution, administration, monitoring, and reporting. CDC's COVID data tracker is an important resource that pulls data from multiple sources into one portal to guide decision-making. U.S. data on administered COVID-19 vaccine doses are also collected by vaccination providers and reported to CDC through multiple sources, including jurisdictions, pharmacies, and federal entities. Multiple methods are used, including immunization information systems, vaccine administration management systems, and direct data submission. Tiberius, likely familiar to many of you, is a software platform that guides distribution of COVID-19 vaccine. Tiberius draws from a diversity of sources, including the US Census, vaccine tracking systems, and commercial logistics companies. It provides visibility of each effort, from manufacturing and allocation of vaccine to granular planning of vaccine administration sites to the provider level. 64 states, territories, and large metropolitan cities work inside Tiberius to decide where their allocated doses will go, from local doctor's offices to large medical centers. These decisions are then sent to distributors to deliver vaccine all across the country. Data in COVID Data Tracker helps jurisdictions plan how to distribute their allocations to vulnerable populations in coordination with complementary federal distribution programs, such as CDC's partnership with chain and independent pharmacies and federally qualified healthcare centers. These partners are able to reach rural and underserved areas, as well as minority populations, to increase access to vaccine. Both Tiberius and COVID Tracker help jurisdictions, pharmacies, and CDC streamline and optimize efforts by working closely to coordinate, track, and monitor distribution. As we strive to make vaccine distribution even more efficient, we are also working closely with partners to increase vaccine confidence in communities and to support equitable vaccine distribution. CDC has developed and disseminated targeted communication materials and toolkits that offer direct technical support to jurisdictions to help address vaccine hesitancy among specific populations. And we are continuing to combat social media myths and disinformation with science-based information. We are also deeply engaged with partners to support outreach to racial and ethnic minority communities to build vaccine confidence and address root causes of vaccine hesitancy in an open and empathetic manner. Like many of you, I recognize that we still have significant challenges with getting complete information on race ethnicity in our vaccine administration data. There are several barriers. Individuals may choose not to report. It may not be required of or requested by providers, and some providers, as well as jurisdictions, have restrictions on data sharing. We are exploring ways to improve this data collection. We're conducting research on messaging to encourage self-reporting on race and ethnicity data. We're reaching out to our provider partners to learn what the barriers are, to identify opportunities to incentivize reporting, and to test strategies that improve reporting. I also look forward to learning more about strategies you all are using during these sessions of the forum. In addition to informing our public health approach, data are also foundational to our efforts to instill trust in the safety of the COVID-19 vaccines. Over 44 million people in the United States have now received the COVID-19 vaccine, and while interest in being vaccinated is increasing among the public, questions about safety remain among the public and even within the healthcare community. The reality is vaccines have undergone the most extensive safety monitoring in US history. We are using new and existing data systems to monitor vaccine safety. Existing systems include the Vaccine Adverse Event Reporting System, or VAERS, Vaccine Safety Data Link, and the Clinical Immunization Safety Assessment Project. We have also launched vSafe, a smartphone-based app that provides personal check-ins after vaccination. This new resource is a key piece in our efforts to rapidly assess for vaccine safety signals. To date, nearly 6 million people have registered and reported data in vSafe. In addition, CDC and others are planning to use large linked data systems to track vaccine safety data as vaccines become more available. CDC is committed to regularly updating the public and providers about vaccine safety as our monitoring efforts continue. Our most recent report was published just last Friday in the MMWR. Fundamental to informing our efforts to end the pandemic and vaccinate Americans against COVID-19 is the need to transform how we collect, use, and share data at CDC and beyond. CDC's Data Monetization Initiative, DMI, is the first ever data-focused strategy that is both resourced and comprehensive. It unifies us in ways no strategy ever has before, and that unity is creating unprecedented connection between CDC, its partners, policymakers, and the public. With DMI, we have been able to expand open data with 158 new data sets added to data.cdc.gov in 2020, a 19% increase from 2019. We've been able to expand data reporting from thousands of reports a week for all conditions to millions of reports a week for COVID-19 alone. We've been able to send nearly 6 million COVID-19 case reports to 62 health agencies. And we've been able to improve completeness of race ethnicity information in syndromic surveillance data that comes in from emergency departments to 91%, up from 80% in 2019. All of this investment underscores how important it is to regularly share data and information among public health partners and to ensure a unified framework for reporting. Our power to learn is woven in our data. I greatly value your partnership in sharing information and working with us to strengthen your public health capabilities to achieve a successful immunization program nationwide. I am proud of our key stakeholders, and I am proud of the number of vaccination efforts happening in our community and in venues such as the retail pharmacy program, health center program, and community vaccination centers that are going to help get vaccines into arms quickly, safely, and equitably. We have achieved a lot in a short period of time. We have learned so much, and we have so much more work to do and so much more we can learn. I am deeply grateful for all you are doing for your communities, your cities, your states, your tribes, and for the American people. Thank you.
Thank you so much, Dr. Walensky. Thank you for that message of hope in terms of the progress we're making in addressing the pandemic with the declines in the number of cases and deaths during recent weeks, and also the challenge to really be able to utilize this powerful new tool in the public health toolbox, the vaccine, and how we can best use that based on the data that we have. So next, it's my distinct honor to introduce Dr. Henry Walk. Dr. Walk is CDC's incident manager for the COVID-19 response, and he'll moderate our Promising Practices panel. Dr. Walk is the CDC expert in charge of overseeing the day-to-day management of CDC's response activities. This panel will feature tribal, state, and local leaders and experts who will share their perspectives and experiences using data to describe vaccine implementation. Dr. Walk.